When our son was diagnosed with stage 4 cancer, we wanted to know everything science and experience has proven effective. What we found was a lot more than we were shown at the hospital. With so many highly educated, seasoned professionals operating outside the bounds of conventional medicine, it just didn't make sense to limit ourselves when the stakes were that high. This approach paid off, and now we're bringing the information to you. Wisdom from the top integrative and holistic cancer doctors and healers around the world, all in one place. Because you deserve true answers to cancer. It's time for a revolution against one-size-fits-all medicine, a revolution that takes us back around to the old ways of healing and forward to the new. That revolution starts right here. When it comes to reversing or preventing cancer, this is where you come for the best of the best. I'm Ryan Sternagel of the Stern Method, and this is the Anti-Cancer Revolution. Hey there, it's Ryan, and this episode is from a deep dive webinar we did on one of our favorite healing products or services that my family feels has made a difference in our own healing journey. If it sounds like something useful to you, make sure to stick around to the end for info on how to get a deal on it and how to be on future webinars live and get a really special deal when they happen. But for now, enjoy the show.
Dr. Schaffner, traditional first question. We're here to talk about Lymphflo and Somnium, but in the world of healing at large, what is the latest and greatest?
I'm geeking out on many things. I don't know how open-minded your community is, but I'm
Extremely open-minded.
So I've been doing this work for about 13 years, and I thought my job was hard enough. I treat a lot of like chronic illness and a lot of Lyme and co-infections and chronic viral infections, and like really looking at the immune system and the environmental factors that are making us all sick. And this, I'm a big terrain person, and I'm happy to share what that means if people don't know what that means at this point of the conversation. But really how no matter what we're up against, making people as resilient as possible. But my job has been really hard in the last 3 years because this whole other thing called, that the virus that shall not be named is on the block, and all the choices and the myriad of choices that people are making. We're seeing really when one bioweapon meets another bioweapon, and I have to actually treat that every day. And not everyone can hear that, of course, and I respect everybody where they're at. I'm being a little humorous right now, but no, blood coagulation issues are skyrocketing. So I'm really interested in getting people's blood moving because oxygen is really important. Mitochondrial health is uttermost important because of what the long haulers are going through is a lot of mitochondrial dysfunction. And so upping my tools in that way. Really kind of this immune shift that's happening too when people are exposed to COVID, it kind of opens Pandora's box. So a lot of things that I had in remission or kind of under control for people, we have to kind of re-look at things and kind of but we have great tools and we get people better, but it sucks. People have to like revisit things they never wanted to have to revisit. But our tools are better and better every year, so that keeps me optimistic. So I use a lot of peptides, and I use a lot of like EBU in my practice, and photobiomodulation. I'm really into quantum physics. So for my patients who can go there, we really try to access that information too to help them. So I'm a very, very busy lady, and my office is very busy just doing the work that we love. And I'm really looking forward to supporting your community because even though it's complicated out there, there are some through lines of what our bodies need day in and day out to do what they know how to do. And the body knows how to heal and knows how to self-regulate. And we just need to be in tune and support it with all that we're up against. So that was long-winded, but that's what I do.
So that said, we are here to talk about two awesome products, Lymphflo and Somnium, which I have been using quite a lot myself and the family and loving it. Yeah, my son actually tweaked his, so with the residual nerve damage, he's still got, because the tumor was in his spine, he has his right leg grew in a little different, and he still got pain in his foot and that sort of thing. And he tweaked it at jujitsu last night and was in a whole ton of pain. But I didn't know if he was going to go to sleep, but I loaded him up on the Somnium, and he slept through the night. So yeah.
Put the Lymphflo on where the pain is too. So then when you do that those two, but I'm grateful he got a good night's sleep, with all that going on.
I'm ashamed I didn't think of the Lymphflo. I'll do it when I get home.
I'm always surprised, and I get anecdotes like every day of, what people are finding with these products, which I really feel honored and blessed to be able to bring to our, your community and my community. And we'll talk about, why the lymphatic system is just this through line in recovering people. And again, it's really confusing when you're in a cancer diagnosis about the lymphatics, but we need really good blood flow and lymphatic flow to heal nerves and to, just really move pain and inflammation out of the body. So there's a lot of anecdotes of how Lymphflo can help people with pain and circulation issues, to restless leg and all that good stuff.
I love it. I know you have a slide deck, which I love slide decks. It gets to the point, but anything else you want to say in general before we get into the meat and potatoes?
Yeah, absolutely. So my goal is to just share, some of my insights. Obviously, we're going to be talking about these two products, but I want to just share where I am at. I'm always wanting to share what I know, and if that can help anyone on the call today, I feel I've done my job. So we're going to have a lot of information with those products as well today. So stay tuned.
I love it. Okay. I will we'll jump in with Ryan's tidbits and thoughts whenever appropriate or inappropriate.
Well, I always, I spend some time, just looking at the amazing work that you do for your community. And I try to put myself in the position of your audience of what I want to gain, to say. So really my title for this conversation is Sleep and Lymphatic Drainage, the Foundation for Your Body's Ability to Self-Regulate. And we'll really talk about what I mean with that. So we'll just get started. So I already mentioned this, right? And when we were doing the intro about I'm a terrain person, and really what does that mean, right? So I studied naturopathic medicine, but I also studied what we call now bioregulatory medicine or biological medicine out of Germany, Austria, Switzerland. That really was a pivotal point when I learned this form of medicine to really help my patients heal and recover. And what this is based on is this idea of terrain theory. So Louis Pasteur was even said to say on his deathbed that the terrain is everything, and he's the father of germ theory. And then Bechamp basically, really talked about treating the patient, not the infection. And this idea, especially now in modern times and with the advent of COVID, we've really been misguided, and we've been so hyper focused on a virus and not on actually our response and our ability to adapt and be resilient and regulate no matter what comes our way. I know many of you are facing, the idea of cancer in your body or your child's body. And this is very applicable to that too, because no matter what you choose as your treatment strategy or your modality, there's so much that we can do to create the best outcomes and to really, really integrate, medicine in the way that I want to, walk us through. So that's what I mean with terrain theory. I'm sure you've talked about this before, maybe Ryan, in your community, but I just wanted to start my slides there. And then I mentioned this idea of bioregulatory medicine. You'll have all my slides. I'll share them with your audience, and then you guys can have them in your portal and everything to look at. So I'm just kind of walking you through. I know children have they have a shorter life, right? So they have a different kind of health history and health story, but it's all applicable, right? And this is like what I go through in my new patient history about, really why is, every patient that sits in front of me, I'm like, okay, what is going on? Why is their body in a state of the inability to communicate, self-regulate? Why has resilience been lost? How do we, harness the innate wisdom, that innate intelligence that all of our bodies have, so it can do the work that it knows how to do? And so we're like, okay, what are the roadblocks and the obstacles in the way? I could do a whole conversation around interference fields, but I'm just giving you kind of my history of how I identify interference fields. So this is a good kind of little cheat sheet and checklist. So if you're stuck in any capacity in your health progression, let's just look at scars. I have a whole conversation later about like how scars can impact our fascia and our lymphatics and our autonomic nervous system and even our emotional bodies. So we want to look at those. Dental history, again, for the kiddos is not always as a big of an issue, but for adults, it can be, because there's a lot of conventional dental practices that can be quite harmful and carcinogenic for patients. This idea of head injury, that can be like, whether it's a minor to a traumatic brain injury, can really affect the pineal gland, the pituitary, the glymphatic system. So it's not a small thing. A mold, I know you do a lot about healthy homes, and I don't need to belabor that here. So mold is still, very misunderstood, and it's carcinogenic, right? It's neurotoxic. Environmental toxin exposure include an EMR. I know you guys talk about electrosmog here, so that's really important. And then I work in the land of stealth pathogens, and I do think, when we're looking at cancer, there's often a viral or pathogenic trigger. It's not, I don't treat like active cancers. I work with collaborative folks. I have a really great team of referrals I work with, but every so often, some of my chronically ill patients get cancer, or I have an autistic child in my practice who just got cancer, or got a diagnosis of AML, right? So we're trying to get him really resourced right now. And so it happens. And, why I'm sharing that is that there's, there are viral drivers, and sometimes even co-infection drivers or mycotoxin or other neurotoxin drivers to carcinogenesis. So we are looking at that. Obviously trauma, you guys talk a lot about trauma and how that can affect the body, and then allergies. So I just wanted to share that. Again, this is off a topic a little bit, but I just want to share what I know. And if you're stuck out there, just kind of review that list. So the two products that we're going to be talking about are related to sleep and lymphatics. So I decided to start with sleep because everybody needs sleep, right? And everyone needs lymphatic drainage too, but this felt relevant to start first. So you mentioned you're geeking out on the different phases of sleep, and I think it's really important. And in the world now, we can track our sleep so much more, for better or worse. All the Oura rings and the like wearable devices that you can turn off the Bluetooth, and you can get the information and then connect with Bluetooth, so you're not having Bluetooth exposure all night. But
Very important. Yes.
it's like, I'm very mindful of EMF during exposure during night, but it is also important to, track our sleep if we can, especially if someone's having issues, so we can really see what's working, right? And so we have sleep is broken up into these different stages. Again, you'll have these slides so you can look into more. So we have non-rapid eye movement, and then rapid eye movement, and then in the non-rapid eye movement sleep, we have 3 different phases depending on where our brain waves are. And this deep sleep is really important, right? So deep is the stage before REM, and deep is this delta wave sleep, these very slow brain waves where our brain is slowed down and our body heals, right? We secrete hormones and we support our immune system. And this is a time that I'll share also. Deep sleep and REM sleep are really important for lymphatic drainage, right? And this is when you're not having good sleep, when your sleep is interrupted. Usually you have shorter times with deep and REM cycles. And so, we have tools to address that, but I want you to, understand this. So again, you can read kind of about the phases of sleep if you'd like to go in there. And then I mentioned the glymphatic system, right? And we'll talk about this more when we're talking about the lymph system. But the glymphatic system, have you talked about this, Ryan, in your community yet, the glymphatic system yet?
Not a whole lot about glymphatic, no.
Okay, cool. So the glymphatic system is the glial dependent lymphatic system. So it is the lymph system in the brain. And it has this beautiful job of clearing waste out of our brain when we sleep. And our brain actually shrinks 60% in size to make room for this passage of lymphatic fluid to flow quite fast through our brain at night. And this is a little kind of very basic picture, but it gets the point across that we have, our lymphatic system we'll talk about is very tied to our circulatory system. And in the brain, the lymph flows along the arteries, and these glial cells or astrocytes, they look like star shapes. They have these little kind of star-shaped kind of structures, and they have these little aquaporin channels on their end feet, and they regulate the flow of lymph through this space. And this is a neuron, so it's bringing this little rod here is like metabolic waste, or in modern times, right, it can be amyloid beta, it can be mercury, it can be lead, it can be herpes virus type 1, it can be parasite, all of those things, right? It's helping to bring oxygen and nutrition to the neuron and then remove waste, and then it flows along the venous system out of the brain. And when you've had a traumatic brain injury, and we know this from NFL players, that if you've had a traumatic brain injury, you're actually more at risk for cognitive decline. And they found it's really the link to the damage of the glymphatic system, which can heal and it can repair. But if you don't know about it, you're working with a damaged glymphatic system. And then we can have toxicant buildup in the space, from these, you can see these little crazy looking astrocytes, and then all this waste is building up. And whenever we have waste build up, whether it's normal metabolic on top of the environmental toxicant, top of the pathogenic load, in a space, that's when we, see this breakdown in communication that can eventually lead to cell death. And then we see a really reduced function. So the glymphatic systems are really important. And that's why we feel better. We feel better, right, when we have a good night's sleep, because not only is our brain going through these cycles of sleep and getting the restorative components outside of just the glymphatic system, but we're really cleansing our brain, and our brain is up against a lot of stress. So this is a really important system. And this was newly discovered like 2015 from my alma mater, UVA. They did a big study, also University of Rochester, and they found it. We're finding still more about the human body, and because we're studying living bodies rather than just dead bodies. Big headline.
Little difference there, yeah.
So, but we have the technology too to look that we were able to really understand and see this happen. So I thought this would just be like a breakthrough and everybody would talk about it, because that to me is so foundational. I see a lot of neurological illnesses, and with any cancers affecting the central nervous system or the peripheral nervous system. This is a really important system to have working, right? So glymphatic system is just there. And then the relationship between the glymphatic system and deep and REM sleep, because my conversation in the beginning, when I was first getting started and educating people about the glymphatic system and getting people to sleep, was really geared on melatonin. And melatonin is important, don't get me wrong. And melatonin is a really important agent, especially in cancer and all the things, but that really helps with the beginning of sleep. It doesn't necessarily help achieve these deep in REM states. I mean, it also assists the glymphatic drainage and getting toxicants out of the brain. But I wasn't paying attention to it sounds so obvious now, okay, I want my patients to have healthy amounts of deep and REM sleep, so they have the full, benefit of sleep and the full activity of the glymphatic system. And so this just talks about why, deep and REM sleep are those times. They're very different times in the brain. Like deep sleep, as I said, is this slower, brain wave. It's, this slowed state that also allows for glymphatic activity. And then REM is really actually a very active time in the brain. in the body. It's a very, basically our heart rate goes up, and, all of these, metabolic processes are like really active. Like, and then this is when a lot of circulation and blood flow and lymph flow is happening in the brain. It's most associated with the dream time and the dream state. And when I was, creating these products with Dr. Ruggiero, I went down the rabbit hole with sleep. And I have some books over there in my office, like Why We Sleep by Matthew Walker and When Brains Dream. And if you want to deep dive into sleep, it's really fascinating. Matthew Walker talks about with PTSD and trauma, it's like the chicken and the egg. People can't get into REM sleep as much because there's this threshold of getting from out of a hyperadrenaline state into, this REM state, and you need GABA actually for that transition. And if you're kind of like on, sympathetic overdrive, you don't always make that transition. And then you need this time, because REM sleep is the only time that the brain is completely devoid of noradrenaline, or the cortisol in the brain. And I don't know about you, but that sounds good, right? Like I want my brain free of noradrenaline 4 times a night. So we really need that. There's a lot of actually research on these stages of sleep, really helping us process our trauma and getting through emotional trauma as well. So,
Yeah, and I'll just throw in one of my favorite cancer doctors, Dr. Jim Roach. I love him because he's like an encyclopedia of medical stuff. When it like conventional or herbs, you ask him about any condition and it'll rattle off like 15 things. And but then he's also very spiritual, and the spiritual component like really plays into everything he does. And one of his big things is, I want my cancer patients dreaming so they can connect to spirit and process their traumas and so on and so forth. And that's like one of his key like things is he'll supplement them to get them dreaming, and he really wants them dreaming. So really big deal. Yeah.
Well, I'm glad you said that. I didn't know, I mean, I started obviously pretty open. I know your audience is open. And yeah, I mean, at the end of the day, like these products and Somnium as we'll share, allows people to really achieve these states and dream more. And I have a very spiritual lens also in life, and with my patients who are open to talking about that, we really achieve a lot of, different types of conversations and, things like that. And, I agree. I think the dream state is a very powerful state. And if you can listen to the themes and what, your consciousness is bringing to the surface, I think it's a really, really important part of our healing that unfortunately in modern life, a lot of people don't even remember their dreams these days. Okay, so you go through this, I think in your in your membership already, but I just wanted to share like some sleep hygiene. So we'll talk about why Somnium is going to help you achieve deep and REM sleep, but just like some basics, right? Circadian lighting. I've interviewed people over the years who are architects who look at circadian lighting. Even in the the modern kind of office environment. I think it's really important for the home environment. There's circadian light bulbs. Dave Asprey has his True Dark light bulb. I have it in my office. When I'm going to bed, I shouldn't be working, but I, work still after I put my daughter to bed, and I surround myself with the amber light, which is really quite healing for the pineal gland. So we need, not these bright blue lights or these LED lights. There's a lot of junk lighting in our environment, and also with the Internet of Things, right? And every new light bulb, we have that issue to think about. So in the Jack Kruse world, right, and all of the, the quantum biology, they're saying, when you wake up in the morning, get that daylight, on your eyes, and when you go to bed, and then being very mindful for your light hygiene during the day, and especially that 2-hour period before bed. So that's important. Creating a safe sleeping location. I think you've gone through this, and this is how, you really want to have a, blackout shades. You've done a lot of EMF education, it looks like. So mitigating dirty electricity, removing electronics from the bedroom. We can't, I have evolving ideas around this all the time, but it's really hard to block out unless you live on a farm in the middle of nowhere, like every exposure. If you're like in a city, it's like really hard to just like get every EMF source like out of your, field. But, where I think we should be mindful and try to reduce our exposure as much as possible and really try to shield if you're going to use any of those technologies is in the bedroom, because we want to have that healing time for hopefully those 8 hours, that you're spending, and really allow the brain to recover, the body to recover, and to create a very, beautiful sleep space. So that's just really, I think, important around the sleeping location.
Yeah, I think if I was in the city, I would probably get one of those tent, like the Faraday, what do you
Yeah,
call it? Like the drapes that go over your whole bed.
we have those. Those are more accessible. Mercola has a sleeping bag. That's an EMF little tent that you can get. You can travel with it, or you can put it on your kid's bed. If you get the bigger like tents, you just want to make sure that they're grounded.
Yes.
Work with somebody where you're not concentrating the EMF, but actually, in a grounded environment. I live in Seattle and there's 5G now and blah, blah, blah. So we actually decided to do the graphite paint in the beds, in the bedrooms. So we
Nice.
do a couple layers of that. That paint's called YShield, and then we grounded that. Again, not perfect because like we don't have we do have the window films on the windows. You just have to look at everything, but again, nothing's perfect because I'm in an urban environment, but we're trying to reduce exposure as much as possible. The core body temperature is actually really important as we sleep. As we go through these phases of sleep, it's actually our body temperature drops 1 to 2 degrees. So that's pretty typical. So I have a chili pad on my bed. I really like that because the natural mattresses also trap heat, a lot of them. So you can get hot during the night. So being hot at night can sometimes affect your sleep. So and then women who are going through phases of life with their, hormones that can, impact their sleep. So just a little sleep hygiene reminder. And then, the pineal gland, right? We're always talking about the pineal gland, circadian biology point, the, consciousness and, esoteric components of the pineal gland. We talk a lot about melatonin, but, GABA actually also has a role with the pineal gland and the health of the pineal gland and the pineal sites in the glial pineal cells. So kind of like the glial cells around the pineal gland have the capacity to take up GABA from the extracellular space and actually to, work with that in order to essentially assist the melatonin production to help, the GABA helps to get into deep and REM sleep. So GABA and melatonin are working together, with the pineal gland to have proper, phases of sleep at night. So GABA gets forgotten a lot when we talk about the pineal gland. It's, melatonin all the way. And, I could do a whole lecture on all the things our pineal gland is up against, right? Between the aluminum and the fluoride and the, the glyphosate and the electrosmog and blah, blah, blah. But there's a lot of things we can do to heal it, right? Just because we have fluoride in our pineal gland doesn't mean that it can't come out and we can't loosen those bonds and, really achieve, great sleep and connection. So
I've been focusing on the pineal gland, the third eye area when I meditate lately, and there's a difference. I'm sure it's like kind of like looking cross-eyed with my eyes closed, but yeah, I'll throw it out there for somebody. Try
yeah, this whole like esoteric component and it's a neuroendocrine transducer. It's taking light energy and kind of transforming it to chemical energy right in the body. And I'm down like the Joe Dispenza rabbit hole a little bit, and there's a lot of knowledge around the pineal gland, and a lot of ancient wisdom always highlighted it, right? And there's a lot of breath work to activate it, so but it really, when you have an awareness of it, you can not only support your sleep, but connect in meditation and on deeper level. I'm glad you're doing that. That's a lot of fun. So this is just like a big slide. I'm not going to read through, but if you guys want to, this is like a lot of the stuff I digested for you about kind of the role of GABA and, how GABA is an inhibitory neurotransmitter, and, everybody's all stressed out these days, for lots of good reason, right? And so we need GABA to balance. It's all about balance of the body, right? And we're a lot of times we're in, overwhelm and sympathetic overdrive for understandable reasons, but how do we kind of support that balance? And low GABA, if you have low GABA, you might have insomnia or disrupted sleep patterns. You might have anxiety, chronic stress, depression, difficulty concentrating, muscle pain and headaches. It can also be, this is not this community, but like more substance abuse, because alcohol, what people like alcohol often is it's GABA, a GABA like substance. And then there's a lot of medications like that trying to manipulate GABA, right? For, pain and stress relief. So, and there's a lot of confusion about how GABA can actually get into the brain. So the delivery method is really important, right, of how GABA can get into the brain. And so you've had Dr. Ruggiero, I think, on your calls before, you were saying. So he's a brilliant mind, and he is a formulator. So he is a medical doctor who has a lot of experience with cancer and viruses and all sorts of things, and autism. And he's a really amazing man, and he understands what we're up against in modern days. So he's creating a lot of beautiful formulas. So we work together closely to create these two products. So one being Somnium and the other GABA. And his special sauce, for both of these products is the delivery. And we use methods that are really accessing the skin, so we're using the skin with a molecule called chondroitin sulfate, which is actually, I have some slides that you guys can read about it later, too, is part of getting that in through the skin into what's called the interstitium, which is like the connecting fluid in the fascia and lymphatic space. And we can apply, basically Somnium, this special GABA with the chondroitin sulfate on our temples and behind our ears at bedtime. And it's actually getting accessed into the blood, over the blood-brain barrier, which a lot of oral supplementation has a hard time doing because of all the pharmacokinetics. So, there's pharma-GABA and liposomal GABA, and, they work pretty good, but this is like noticeable in how fast it works for most people. So we know this goes across the blood-brain barrier. So this is just like a bunch of benefits from it. And I have, with people having their Aura ring and everything, I had one patient, he's so sweet. He was showing me he was getting 4 minutes of deep sleep a day, 4 minutes. And with one use overnight with Somnium, he had his deep sleep go to 2 hours.
Wow.
Because I don't get that kind of data usually, because not everyone's tracking their sleep. So this is, nothing's 100% or panacea right for everyone, but the majority of people who work with this product have a really positive result. And can be used for sleep. That's obviously the number one. I use it sometimes to meditate. I'll use it sometimes when I'm, in in front of like 500 people to public speak. I'll sometimes like put it on my, chest or something just to, help me in those stressful times, and there are stressful times in life, right? For our kiddos and, for everything that everyone's going through on these calls. And so this is a great tool primarily for sleep, but it can be used to enhance meditation and to reduce, any time in life when there's a high amount of anxiety. So, so that's all of the benefits, and that's just our visual. It comes in a little pot, and we have that available for you guys. We're gonna have a good discount and a gift if you guys decide to purchase today, and then some testimonials, just so you can see it's not all me, it's it works. And This is real quick. This is Ruggiero. I shared that patient, but Ruggiero did this one as we were getting this on market, and this was a deep and REM before and after Somnium. So that was pretty cool. So this is just, he had a Garmin watch, not a Aura, this person. So lots of ways to track sleep if you're mindful, and you can really see the benefit. So anything you want to talk about?
Well, yeah, I'll just say one. Yeah, Dr. Ruggiero. I'm not sure who was on the call where we did his probiotic that makes you more EMF proof, and I was like, I get pitched products all the time to, it's like that's my inbox just filled with people trying to get me to promote their stuff, and I was like, come on, but. I didn't know that it was Dr. Ruggiero first that formulated it. And then once I found out it was him, and he's like ultimate next level guy when it comes to, all the quantum biology stuff you referenced, and just really knowing what's going on. And yeah, so that was a fascinating call. And then when I heard about your products, I was very interested because I've followed your work for a long time and have a lot of respect for what you do. But then when I found out it was Dr. Ruggiero, it's like, oh man, yeah, I gotta check this stuff out. And whether you're tracking your sleep or not, what I said in the email is just use it and then notice how you feel when you get up the next morning. And whether you're tracking or not, it's like there's like, oh wow, that's a big difference, a really big difference. And tell me you don't feel like healthier and more vibrant for having used it is all I can say. Yeah.
Saying that, yeah. And my husband is not in my world at all. Like, he's like, totally love him, totally very supportive, but like he's not doing what I'm doing all day. Let's just say that. And when we got Somnium, I'm like, Dan, like put this on and see how you feel. And he's like literally talking to me, like, yeah, and like then like passing out. He like just went to bed. Woke up the next day, he was like, Christine, that stuff like is amazing. It really works. And I'm like, of course it does, but I'm just saying, like, even somebody who wouldn't even have a placebo response, had a positive result. So I'm happy that you're using it in your family too, Ryan. I think that's always fun to of course share what's working for you guys, right? So and we've had a lot of fun just hearing from patients. I literally recommend this product for like 95% of my patients. I energetically test everybody, so I'm always testing everyone before I make my protocols and everything, just so I'm making sure that I get everything really bio individually for them. And this is a staple in our community. So
well, now I got to know what is I hear energetic testing all the time, and then when I ask what are you doing to energetically test people, it's a wildly different answer every time. What is your method of energetically testing people?
In the last few years, I've kind of like, with some emerging tools that I've integrated, this is kind of my process. So I'm like a normal naturopathic doctor and do all my doctor stuff, like history, lab work, blah, blah, blah. And then I scan everybody with 2 bioenergetic scans, one being the AO scan and then the other being the NEST scan. And then after I have all this information, I was trained in autonomic response testing. I have a little bit more of a variation of that, but that was kind of how I was trained. And so it's a form of really kind of a evolution of applied kinesiology, where we're really communicating with the biofield, right, and the autonomic nervous system. And there is a way to measure stress response through looking at the fascia and looking at the fascial connection and the muscle connection when there's stress in the field of somebody and when there's not stress. And so we use these kind of principles, and nothing's 100% perfect, but my job is really hard, right? Because I sit in front of people and there's like so much to do, right? And we have to prioritize. So this is a really great prioritization tool for me. And it's keeps me in practice, and people tend to really respond well to it. So, there's probably lots of reasons why it works, to be honest, Ryan. I work with another doctor, and I think when you work with a group of people intending for another to get them well, you access a whole other information field. And I think we're accessing that at the same time. We're interacting with the patient's energy. How many times do you not, you see doctors don't even touch people anymore, right? So there's just this other extrasensory perception and information that I'm really trying to tune into as well. So sometimes when I'm typing, I'll be like, in front of the, computer, or talking to someone, my mind will be like, okay, let's do this, let's do that. And then when I'm with their body, I get a whole other set of feedback. And I just have learned to trust it over the years. And there's a language. I mean, there's a language with the world of not only, traditional applied kinesiologists, but also in quantum physics that really, shares what's happening. So I'm continuing to evolve, but it's how I practice. So that's a whole aside, but there you go. So that's my kind of spiel on sleep. And then I want to go into the lymphatic system, if that works for you. And I'm happy to answer questions if any questions are coming up. I don't have the chat open.
Yeah, there's it's actually a good question. What are the ingredients of Somnium?
Somnium has a blend of natural oils. There's cocoa butter and shea butter, and it has it's proprietary. It's a probiotic blend of it's a microbial blend of chondroitin sulfate. So it's vegan if people are into that, but it's probiotic derived, and then it is it has GABA in it. The GABA is proprietary. Dr. Ruggiero hasn't even told me how much it is, but it's a very biologically compatible amount. Very, very safe. There's never had any side effects or toxicity effects. Like a bottle that we sell lasts a long time, because I don't know about you, Ryan, you just put a little bit, goes a long way.
Yeah.
Using principles of getting through the interstitium and the blood-brain barrier topically and bypassing the digestive, and in a oil, like a nice natural oil base that's absorbed in the skin, plus the chondroitin sulfate, which is basically kind of that carrier into the lymph, and the carrier with the GABA into the brain. So that is, what's in there. And then we have a full ingredient deck that you can, check out and make sure that is all good for you on the website. But everything is, natural and as organic as, possible. Sometimes some things that are not quote organic are actually safer than, the ones that aren't labeled. So, Marco and I put a lot of time and intention into sourcing. And so it's really clean. So.
Yeah, that's another reason that 99% of people that hit me up to promote their product don't get a response. Or when I ask for the COA or something like that, then the conversation dies off quite quickly. But yeah.
You have to be, more and more mindful. And I've even seen my patients, like, sometimes they're like, whatever, trying to get something on Amazon, and they're like, fraudulent products now even out there. It's like the Wild West, which is, it continues to give our industry kind of like this weird, polarity. But I put this on myself, my kid, every day as well. And, I try to walk my walk as best as I can as well. Okay. So we'll go through the lymph. And again, I want to educate you about the lymph, and then lymph flow is really kind of same principles. We're using the microbial chondroitin sulfate, but through some other oils, and then phospholipids, and then the secret sauce is the probiotics that produce macrophage activating factor, which have you ever had any conversations on GCMAF or anything like that?
A couple old podcast episodes, but it's been quite a while. Yeah, and that's the other, like, I didn't even know about that until you and I started talking, and that's like, oh wow, that's a whole a whole side benefit that's it's not even really advertised. Yeah.
Yeah, we have to be careful, right, about how we advertise these things, but it is, these microbes, right, are amazing. And most of the reason why they work so beautifully in our bodies are because of the peptides they produce and the byproducts they produce by their natural fermentation process. And in Marco's brilliance, knowing how much GC-MAF was such a game changer in the cancer community and as an antiviral as well, he found out a safer, more kind of cosmetic way to more biological way to get this on the market rather than through an injectable. So this helps us to get past a lot of maybe hangups around talking about the lymph. Also, if you have cancer, because it's actually an immune therapy at the end of the day that we're using that is very safe. I mean, we all produce macrophage activating factor in our bodies. So it's not like a new drug or anything like that, but it's a way that we get our immune system to fight viruses and cancer cells. So it's the lymph is really a great place for it to be working. So I won't read my slides, but this is a beautiful picture of the fascia from Dr. Jean-Claude Gumberto's work with the architecture of living fascia. Again, another brilliant man who decided to study the living body rather than the dead body. And dead bodies, when we just kind of go through the connective tissue, when we're doing cadaver lab, we kind of just say, oh, fascia is just this saran wrap and it doesn't serve a purpose, but it's actually the water irrigation system as well as the communication network in the human body. It's a fascinating deep dive, and really kind of what Dr. Jean-Claude Gumberto as well as Dr. James Oshman have come to terms with is that we are connected from our skin to the nucleus of our cell, affecting epigenetic expression through this fascial network. And that's a big statement, right? But we can really affect our epigenetic expression through accessing the skin. And that's really what I wanted to share here. And then when we think about the lymph lives within the fascial network. So we can't really talk about one without the other. So just a quick overview, the circulatory system and the lymphatic system are highly interconnected. So if you don't have good blood flow and circulation, you're most likely going to have stagnant lymph. So real quick, as the blood leaves the heart through the arterial system, you love anatomy. It's like arteries are red, right? Veins are blue, lymph is green, but it's more complicated to that. But, this is just oversimplistic. And so, the arteries basically deliver oxygen-rich tissue or oxygen-rich blood rather into the tissue space. And they kind of end in the tissue space in these capillaries. And in this capillary space, actually, most of the fluid out of the blood leaves the blood and it becomes interstitial fluid or pre-lymph. And then a good amount comes back and goes through the venous system and gets back to the heart. And meanwhile, this fluid that we'll talk about starts to bathe the extracellular matrix and the space between the cells, and then it gets recirculated and really managed in the body through the lymphatic network, where the lymphatics is a really important system for detoxification and immune surveillance. So we have to get waste out of the tissue space, as well as we really have to also have our immune system, mount a response to what we're encountering in our environment. So this is really basic. And then again, just going a little deeper, this is kind of the tissue space, and then how lymphatic capillaries, it's a network, kind of go into vessels and, meet nodes. And then I'll show you in a couple other pictures how we have really two big spots that where the lymph empties back into the circulatory system, the thoracic duct and the right lymphatic duct. And that's why this area in the body is a huge lymphatic drainage area. If you have ports and stuff, they can be, along these areas, and which is needed, of course, but it can be impacting the lymph. So then again, just a picture, this is Jean-Claude's video of a lymph vessel, or a picture rather of a lymph vessel. So I don't know, I'm a geek about this stuff. So I'm like, oh wow, look at what a lymph vessel really looks like rather than this green little, vessel here. So here we are, the lymphatic system, and then the extracellular matrix is actually really important in the cancer process, and just in the process of, how we're wired to heal and repair. And so as this lymph, as I mentioned, leaves the capillary space, it's encountering really the fascial network, right? The collagen and mast cells and hyaluronic acid and proteoglycans and chondroitin sulfate and our immune surveillance. And that fluid dynamic is moving its way into the lymph vessel. And my friend, Dr. Rob Cass, who owns Physica, he says that everything that comes out of the blood takes a somewhat complicated route through the connective tissues to the parenchymal cells, which are just the cells in this space, and into the lymphatics. And by the extracellular matrix regulates the cellular milieu, right? The cellular environment, which is the crux of health, right? And since the lymphatics are highly intermeshed with the extracellular matrix, we can change the terrain. We can change our epigenetic timeline by lymph therapies. Wow, right? That sounds important, right? So we can actually, by draining this space, it's really, health is complicated, but it's simple. But by draining this space and keeping this space moving and allowing our body to do the work it knows how, we help to keep up with the demand of, not only metabolic, activity, but all of the onslaught of environmental toxicants and pathogens that we're up against. So lymph therapies are big. And if you want to know more about the extracellular matrix, this is just Dr. Pischinger. He's an Austrian physician, and he just said, like, almost every disease starts within the extracellular matrix. And we talk about the cell all the time, but it's the environment around the cell that actually is more important than the cell itself. The cell takes its cues from the environment. Is the really the summary of his work.
I thought it was all disease begins in the gut, which always drives me crazy. That always seemed way too oversimplistic for me, but
right. And sure, that's important, but it's like, if your lymph in your gut's not draining, like, forget it, so I'm with you there. I think the point that I just really wanted to get here is to kind of walk us through that, we taught, this is just another view of the the ECM, and then these really beautiful feathery like substances here, which are called proteoglycans. And then I'll show another slide that one of the glycosaminoglycans on the proteoglycans is actually a chondroitin sulfate. And that's why chondroitin sulfate is so important, because it's a really important part of this extracellular space, and it gets damaged a lot, by everyday life. And so that's why Marco, in his brilliance, decided chondroitin sulfate was actually like one of the best tools to deliver things into this space. And then this is just like chondroitin sulfate a little bit deeper. This was really kind of fun. This is, if you're a geek and want to read about energy medicine by Dr. James Oshman. It's a brilliant book. And this is a visual out of his book. And, grounding, why grounding works is because we actually absorb electrons, from our Mother Earth. And we actually store our electrons in these proteoglycans, chondroitin sulfate, glycosaminoglycans on the proteoglycans. So this is like hyaluronic acid, keratin sulfate, chondroitin sulfate. And because all this stuff is going on in that space, we need electrons, right, to help with the reactive oxygen species and, all of that. And modern life steals our electrons, right? And that's why we have to go replenish our electrons. And so he talks about having a inflammatory preparedness by having, a good amount of electron reservoir in the chondroitin sulfate. Or we can just give you really, highly rich electron-rich chondroitin sulfate through, these products as well. But that clicked for me when I was like, oh, that's why grounding works, so but there's a lot of research around grounding. But
yeah, no, it's all these side benefits that I just knew that Dr. Schaffner and Dr. Ruggiero made an amazing Lymphflo cream, but you get your electric charge in as well. That's awesome.
Thank you. So again, the interstitium, Marco talks a ton about the interstitium, and that's why we're using the principles of the interstitium. They're all words for the same thing: fascia, interstitium, lymph, and we like to try to, in anatomy, like make everything compartmental, but it's all kind of one big intermeshed soup at the end of it. But this was also newly discovered organ, the interstitium, right? And we got the glymphatic system, the interstitium, the mesentery. What's next, right? So these were all newly discovered. So this is just how we get, basically these products to kind of travel within the fluid spaces within the fascial network and in the lymphatics. So just again, people can read this. This is kind of a little woo, but I figured you'd like to go there. So the living matrix is this term, like synonymous with the fascia definition, from the skin to the nucleus of the cell. But really what's happening, right, is all of the, from the skin through the fascial network, these proteins are keep on, there's no break in connection. And when we get into that extracellular space, those the collagen and the the fascial network basically crosses over the cell membrane with integrins and then hooks into the microtubulin within the cell and into the nuclear, nucleus and the nuclear cytoskeleton. So we have this one connection that's bidirectional, and we can, this is not only all around movement and hydration and communication, but this is the path for energy medicine to work. This is the communication highway for light and sound and frequency. And this is why someone can put their hand on your child or you and do myofascial, cranial, whatever, and all of a sudden emotion gets released out of the stored tissue and trauma in that tissue. You know what I mean? That's just like, this is why that happens through the misunderstanding. So this is the living matrix, generates and transmits vibrations in the form of mechanical waves, electrical signals, magnetic, electromagnetic, heat, and light. So that this is a passion of mine, energy medicine. So I always try to give people a understanding why it works. So this is really what it looks like in real time. And then when we were thinking about lymph drainage, I think this is like a really bad photo, but it's the only one that gets my point across. That basically when we're thinking about drainage, so the right side of the body, basically here to the right under the breast, like, I'm going backwards here for you guys. Well, no, I'm like having my right, but I'm just, you look at the picture like this is your right. To have you guys, I'm not a yoga teacher, so I'm like, in my, so just, figure out what your right hand is, right? And, essentially the right side of the body drains, in that way. And then the left side of the body is essentially everything else. Isn't that crazy? Like the left side of the body has all this work to do, right? So it's really important when we're thinking about, the principles of lymph is like, you want things to have somewhere to go. So in order to drain the whole body, we want to make sure that like this area is open, right? So we can, do manual. My friend Kelly Kennedy is always showing people how to pump their lymph and everything. We can put Lymphflo on the clavicle is a really good way to just make sure you're getting everywhere. And then, I just kind of inserted this, when we're thinking about the brain, so we want that glymphatic, you're getting good sleep, the glymphatic system's working, but it has to drain out of our head and actually drains through the cribriform plate and the tonsils. And a lot of kiddos have swollen tonsils, and they, part that can create stagnant lymph in the brain, if it's too congested here. So Marco really showed us that we need to drain the cervical lymph nodes. That helps to drain the tonsils too. And then that allows all this lymphatic fluid to go somewhere, because it will do its job, but if it's jammed up somewhere, if there's a traffic jam somewhere, then it won't be able to drain as well. So when we have people put the Lymphflo on their clavicle and then on their neck at night to assist in lymphatic drainage. And then
I don't have my tonsils, so I don't have to worry about that. I wish my parents knew about Lymphflo before I got them yanked out. Yeah.
You had your palatine tonsils probably taken out and maybe your adenoids, but we still have tubal tonsils and lingual tonsils and a whole ring of lymphatic tissue. So there's 5 tissues there. So you still got to look at it, right? If you're in my office, I would inject your tonsil scars so that you have really good lymphatic drainage with, neural therapy. So invitation, Ryan, if you ever want that. So this is just the lymphatic, system here and how we can drain the brain by draining the neck. And then this is, I don't have a picture, but the vagus nerve, it kind of sits right here too. So we hear a lot about the vagus nerve, right? So we want to, there's a whole hypothesis that if there's infection and lymph stagnation here, that actually can create infection and toxicity in the vagus nerve, and then that can impair communication. So you're actually helping to open up the vagus nerve as well. And then I mentioned, tonsil scars, but we use Lymphflo topically for scars because scars can be these islands of turbulence and this traffic jam within the fascial network that can essentially affect the fascia, the lymphatics, the autonomic innervation, and they can hold trauma, where for various reasons of why, you have those scars. I use neural therapy, so I'll inject them, every day, and most people will have some type of release, whether on their table or on the table or later, because of how memory is stored in, there's something called fascial memory. And I could do a whole lecture on that, but that is, very real phenomenon. So, physical and emotional scars. And then this is also Jean-Claude's picture. So this is under the skin, and you can see scar tissue is just a plug, right? So if you're a child or you've had to have surgery or have had an injury, that's amazing, right? The body can heal and repair, but the scar tissue is going to be more of a plug to just, make sure that everything's okay. It's not going to restore it to its normal kind of fascial, framework. And so this can be an area of more tension and more restriction, and it can hold more toxicants or more pathogens in that area. So we want to constantly kind of work to mitigate kind of some of that stress on the overall system. So when you're thinking about just draining your lymph in general, just take like a real quick, like, where are my scars, right? And if you live in a community where neural therapy is available, seek out a neural therapist. But if not, there's lots of ways to do it, right? You can use acupuncture, needling, you can do photobiomodulation, and then you can do Lymphflo, and just be very mindful and putting Lymphflo to kind of bypass the scar. So that's Lymphflo. It has basically phosphatidylcholine, the probiotic blend, and microbial chondroitin sulfate. And the magic of the cream really is the GC map that the probiotics create. So we're not only getting all the wonderful benefits of the chondroitin sulfate, electron-rich chondroitin sulfate, exclusion zone water, and the lymph that also helps to move the lymph, but we're getting the immune benefit of, if you have congested lymph, you typically have a chronic infection or some reason why you have that traffic jam. And so we're helping to support the immune system clear that. I see all day long people have all these swollen lymph nodes, and we get them to drain with Lymphflo. I'm not your doctor, always do this with a doctor, I have to say that, but this is, lymph is very misunderstood. And I feel like because we're not just moving lymph without an immune, support, side by side, I feel really confident in this treatment. And then you can read some testimonials. And then, we just, see a lot of great anecdotes. Again, wherever there's stagnation, pain, poor circulation in the body, we just put a little Lymphflo there. A little goes a long way. It's in this combination of really nice fruit and seed oils that are really the consistency is all about, you can rub it in your skin to kind of get the blood flow going, and then it absorbs really nicely. And people feel, everyone has their experience, but I see a lot of very fast effects with this cream.
Yeah, no, I'm excited about it because my son has many scars from operations and so on and so forth. And yeah, I've been loving it for that route, which I didn't even really realize was a benefit until I talked to you more about it. And yeah, I'm really excited about that. And then we do have, like, I think it's good, a couple questions on just optimal usage. Julie's asking, how often do you use the Lymphflo cream? If you utilize myofascial release, can it be used on the same day? Can it be placed on the lymph on the face? Can she show us again where to put the cream, how much per treatment, and how often? So yeah, I mean, we talked about, like, specifically scars and scar tissue and that sort of thing, but yeah, general lymph drainage. Is there an optimal optimal routine to people should adopt?
So I do this every night, and I encourage my patients to. So really, the Lymphflo was created to improve glymphatic drainage. Did I tell you about the Marco and Bradstreet, when Bradstreet was alive, looked at ultrasounds of children with autism, and there was a pooling or buildup of fluid in the brain. And so their thought was, if we can get the neck to drain, then the fluid can drain, and then the brain can communicate better. And they found out. And so this cream was kind of, evolved from that idea. He was using ultrasound a lot too. So what we do is I put my Somnium on. I instruct my patients to put the Somnium on. You can put it on your temples. And then Marco likes us to put it on, like, the top part of our ear. This is the thinnest part of our skin. So when we're thinking about going into the brain, it's local and it's a thin skin. So I just kind of go here and kind of right here. You don't, like, there's no wrong way of doing it, but, like, that's like the optimal. And then we put the Lymphflo, so on the neck and then on the clavicle. So I do that at bedtime. I was going through some things, and I've been pregnant before, and usually ladies get, like, a little swelling in their legs. I put it on my ankles at bedtime to help with the lymph drainage. You can put it on the scars at night or during the day as well. It can assist and support your lymphatic therapy, so myofascial or lymphatic therapies. Also, I use, like, a lot of castor oil packs in my office, but sometimes, like, if you need, like, a stronger treatment, let's say your kid's going through, like, chemo that day or something a little bit more intense, obviously, you can do your castor oil routine, but you can put Lymphflo on the liver and on the kidneys. So I do that a lot too. For women and, everyone, we have a lot of lymph nodes, obviously, in our armpits as well. So you think about areas where there's a lot of lymph, right? So neck, that's routine, get the lymph to drain. Then we have, we're always opening up the clavicle because of the thoracic duct and the right lymphatic duct. We have groups of lymph nodes in our armpits. In the middle of our body, there's something called the cisterna chyli, which is a big drainage place for our gut to drain. So you can put it in the, just in the center of your abdomen, kind of in the, where your ribs are, kind of in the, like where the point of the ribs are. And then you can put, like, in the kind of the groin area where your kind of a bikini line or underwear line would be. There's groups of lymph nodes, obviously there for the pelvic bowl and to help the legs drain. And then you can put behind the knees, if there's, like, swelling in the legs, you can put it behind the knees to help the legs drain. And then I mentioned, like, edema around the ankles, you could do that. I also, like, encourage, if there's someone in acute pain, like you were saying, for your son, like, just put a little there. A little goes a long way. So it is, like, really, when you get it, you can keep it in the fridge. We use natural preservatives, so that's just the best way to keep the creams. But you don't have to. I mean, like, I have Lymphflo, like, right here that I put on patients, and it's a little just more, liquidy because the the coconut oil in there. But you can keep it in the fridge. And then Somnium has a little bit of a different base, but they're both really lovely oil blends that go in well. So a little bit, little bit goes well for the Somnium. And then depending on what you're doing with the Lymphflo, you can kind of, guide your application, but you just want to cover a thin layer wherever you apply it.
I love it. Lydia's asking about the fragrance for people sensitive to smells because of chemical sensitivity and or mast cell activation syndrome. I would say it's got a mild
Yeah,
pleasant smell, but
yeah, there's no fragrance. And I have like a lot of my patients are, mast cell to histamine intolerant. I have very, very sensitive patients. So they humble me all the time on what can be used and what cannot be used. And Lymphflo is it meets the mark for those sensitive patients. Somnium and Lymph Flow. A lot of my patients who are the canaries who will tell me if they react to anything, they tolerate it.
anything to be said about early onset dementia and either Somnium or Lymphflo?
Yeah, I'm sorry about that, but yeah, that comes up in my office, and these are great foundational products for that. Because remember, with dementia, we want to get the glymphatic system really working and moving, and then we need to understand why the early onset dementia is happening. Is it a prion illness? Is it a mold exposure? Is it Lyme in the brain? Is the mercury toxicity? Or a bad root canal, or the oral microbiome being an issue? Is it, you know, all these other things and all of it in between, so we look at all of it.
Here's a good question. Do they need to be used forever? We're pretty big on like rotation, and I've got to I try to categorize things and rotate between different categories, and so I'm kind of hitting the mark here and there and mixing it up and that sort of thing. But yeah, as far as an extended, do you use this? Do you use a bottle and then take a while off, or what's kind of the optimal the long haul for Lymphflo and Somnium?
Yeah, it's really up to you. These aren't it's not like a methylation pathway we're working with, or a charcoal or a probiotic that you need to rotate. It's really a staple in my protocols, and most of my patients use these regularly. I use these regularly in my life. I don't know about you, but the world is pretty stressful these days, and so I think unless we're on these beautiful farms or this beautiful land and have the very low stress life, maybe it becomes just a tool here and there. But I just see the opposite, that we're up against a lot, and we just, as modern people, need modern tools and therapeutics to maintain our health in such a stressful environment. So I'm all for changing that, and however we can do that together. But in the meantime, these are good tools to weather the storm.
How do you evaluate what the lymphatic and glymphatic systems are doing? I know thermography is helpful for that. Yeah, what can people know or do to know how their lymph and glymph systems are actually working or not working?
Yeah, it's a really great question. And I do have regulation thermography in my office. So that's looking at the nervous system. It's not the infrared camera, and it has a really good window into the lymph. I have a slide around symptoms with lymph congestion, and I didn't add those to the list, but I will just kind of walk through, right? And I'm a clinician, at the end of the day. So my job is just to get people feeling better. And so that's really my guide when symptoms improve. Yes, we track tests and all sorts of things, but at the end of the day, do people feel better? And my job is not done until they do, right? So when you think about it, do you have lymph congestion, brain fog, anxiety, depression, insomnia, sinus congestion, cervical lymph node congestion, ear congestion, any allergies in the body, any pain, any inflammation, cellulite, gut issues, neuropathy, and the list goes on. But that's just my top top list, that but a lot of things, there's a lot more awareness over the last few years around the lymph system. I think a lot of my good friends actually are talking about the lymph system alongside me, which we're happy to get a movement around. But it's still very much under addressed, and there's so much more room for education and how important the system is in the body. My patients really taught me this. I just paid attention, and I saw the people who really started doing lymph drainage when they were really sick, they got better way quicker. And I was like, what is going on? And then I was like, that has to, we got to talk about that all the time. So that's how this all evolved in my world. Yep.
And again, this was a recording from the weekly webinar series. We invite our entire Stern Method and Anti-Cancer Revolution email list to attend and ask questions live as they happen. Please know that any product or service featured on this series is something I personally feel very strongly is something that has helped my son and family in our own healing journeys. It's only the best of the best, in other words. We're very serious about that and refuse to talk about something we don't enthusiastically use for ourselves. As you can tell from what you heard on this episode, you can use code STERN, S-T-E-R-N, for a great discount at any time on this company's site, and you can find that link and any other information you need to get it in the show notes. And also know that for the week after we actually did this webinar live, the discount was way bigger. The agreement we make with all the companies we feature on our live webinars is that they're going to give our audience an unheard of deal, something way more exciting than they'd hear on a podcast or see in a social media ad, but only for a week. And then after that week-long period, it drops down to more of the standard podcast or social media discount. So if you're the type of person that's always on the lookout for the best possible deal on the best possible healing products, from supplements to gear and devices or healing services like testing or more energetic type stuff, and if you're listening to this podcast, I don't know why you wouldn't be, you need to be on one or both of our email lists. You can click the link in the notes to sign up for the Anti-Cancer Revolution, which is the official email list of this podcast, delivering the show notes for all types of episodes we do, along with other cancer-specific information right to your inbox, and the Stern Method, which is our family brand where we show all of our strategies and routines to incorporate all the healing stuff you hear on these podcasts into our lifestyle, along with other important things happening in the health world. And I should also mention here that for many of the products featured on these webinars, our Going Integrative Plus members actually have access to that crazy, unheard of deal anytime they want, instead of just for the week when the webinar actually happens. If you've listened to the other episodes of this show, you know that Going Integrative Plus is the resource my wife and I have created to make it possible for everyday people to ask their own questions to the top holistic cancer doctors in the world each and every week, which is the most valuable thing we could imagine for someone concerned with cancer. But in thinking about how to make it even more valuable, we've worked it out with a lot of the companies you hear on these webinar episodes to actually offer that crazy deal that's only supposed to last a week to our members year-round. So in all reality, you could be a member and never get on one of our live Q&A calls, which I don't know why you wouldn't, but even if that were the case, you'd still be coming out way ahead just utilizing the discounts. You can see all aspects of the community and become a part of it at goingintegrativeplus.com if you feel like this would be a helpful thing for you. And as always, remember, if you're going through cancer or anything else you'd rather not be, just keep going. God bless and Godspeed, and we'll see you on the next one.